Authorities tell News 8 he was watching the child for the boy's mother. News 8's Tina Detel was in Danielson Superior Court, where he made his first appearance on these charges.
He is a flight risk.
38-year-old Sean Holmes faced a judge today after an incident in August which left a then 4-month-old infant with serious injuries.
Several fractures to the skull, a brain bleed, bruising and swelling in the eyes, and several broken ribs on the right side.
Holmes told the baby boy's mother he fell asleep with the child while watching him, and he fell on the floor.
He seems to have been cooperative with the police.
But police didn't buy it, and neither did doctors who examined the infant.
Trauma is the cause of these injuries.
His arrest comes after an East Lyme father was accused of abusing his 4-week-old twin daughters, and after a Naugatuck man was accused of brutally murdering his almost 1-year-old daughter. A daycare owner and her boyfriend were also arrested this week for alleged child abuse at her home daycare in Wallingford.
It is a responsibility on the part of adults and parents and caregivers to have the capacity to put aside your own needs to focus on the needs of children in our care.
Dr. Laura Saunders says abuse often starts with stressors, such as financial or familial. But the first thing that needs to be done is to recognize you need help and get it. Holmes has several past convictions for burglary and larceny, but the state said in court today what may be most disturbing is that this is his 3rd domestic violence arrest. Now, the actual charges he faces are risk of injury to a minor, assault, and interfering with a police officer because police say he resisted arrest. The deputy commissioner of DCF says cases involving violence are not common, with approximately 16% of the overall reports involving physical abuse. Those most vulnerable in our communities, children 0 to 3 years of age, must remain in the forefront of our efforts.
It is the responsibility of all adults in these situations to step forward to protect children.
Dr. Saunders says ignoring it or wishing it stops will not help. Tina Detel,